We have we have Professor Elizabeth Ogboli Nwazo, who is also here with us tonight. You are welcome. And I must also welcome our dear pharmacist, Dr. Abdulrazak Ayuba. You are also welcome to the.
Thank you, sir. Good evening.
You are welcome, sir. And
Thank you, sir.
we have Professor Basil Bello, all the way from our orthopedic and sports physiotherapy, right here in Ibadan. Without wasting time, I want to welcome everybody to this meeting tonight. This webinar is a special one because we are having a form of symposium and discussion generally on what it pertains to us. And there is interest of carrying out pain research in Nigeria. What do we pass through? What do we experience? What has been our experiences? Generally, that's what we'll be sharing today. And before we go into the uh, the discussion tonight, let me briefly uh, talk about some of our speakers. We have Professor B.B. Owoyele. He had his education at the University of Ilorin and also in Ibadan. He had his MSc in Ibadan and PhD back in Ilorin. I was a fellow of Harvard University. He is a professor of physiology with specialization in neuroscience, and he had served as head of the Department of Physiology, University of Ilorin, also the dean of the postgraduate school at the same university. He is a immediate past president of Neuroscience Society of Nigeria, like I said, and the Society for Experimental Biology of Nigeria. But currently is the chair of the Fellowship Grants and Award Working Group of the International Association of the Study of Pain, and he has more than 150 scientific publications in reputable national and international journals. Next, I will speak about Professor Elizabeth Ogboli Nwazo. Professor Elizabeth Onowa Ogboli Nwazo obtained his MBBS from Abu Zaria in 1990. Is a fellow of West African College of Surgeons in anesthesia, got that in 2002, as public health in 2010, and a post-fellowship diploma in obstetric anesthesia and pain management from Israel. She's a professor and chief consultant, Department of Anesthesia, College of Medical Sciences, Ahmadu Bello University, and Ahmadu Bello University Teaching Hospital, Zaria, Kaduna. She's the past president of the Nigerian Society of Anesthetists, 2018 to 2022. She's formerly the president of IASP Cancer Pain SIG, 2018 to 2024. Currently the president of IASP Pain Education SIG, 2024 to 2026 as we speak. Professor Ogboli Nwazo is the past vice president of SSPN and now the current editor-in-chief of the Society's Journal. He's also a member of the board of trustees of SSPN. Professor Nwazo has published 6 medical books, 44 articles in international medical journals, and over 65 presentations in conferences all over the world. She takes special interest and has conducted research in pain management, critical care, airway management, and patient safety, among other things. Professor Nwazo, you are welcome tonight. Also, I have here our dear pharmacist, Dr. Abdulrazak Ayuba. Dr. Ayuba is a graduate from Abu Zaria. He successful a national service at Ahmadu Bello University Teaching Hospital and rose to the rank of Deputy Director of the Pharmaceutical Services. He has many career achievements as hospital pharmacist, and he has a lot of professional and university qualifications from Uniben, from Yaba, from Abu Zaria, and from Abu Teaching Hospital, that's Abu Teaching Hospital. He has a lot of working experiences, which you may not be able to say all, but he's a pharmacist. He was a pharmacist in 1993 to 1995. He rose to senior pharmacist in 1995 to 1999, principal pharmacist 1999 to 2001. Eventually, he retired with ranks of Deputy Director of Pharmaceutical Services at Abu Teaching Hospital, and he's a part-time lecturer pro bono with the Department of Clinical Pharmacy and Pharmacy Practice Faculty in Abu Zaria from 2010 to date. He has a lot of training, a member of various societies, and he has coordinated a lot of activities in his field, his expertise. He has a lot of professional responsibilities, a lot of positions as chairman, secretary, vice chairman of various units and committees within the university in Kaduna, from Abu, and other closer states. He's a member of many learned society, more than 10 society amongst we have the Cancer Society of Nigeria, we have the International Association of the Study of Pain, and of course SSPN, and also the West African Society of Parenteral and Enteral Nutrition. He has received a letter of recommendation from ABTU Board of Management on successes management of DRF operation in AB Teaching Hospital. So he has many awards, and pharmacist Dr. Abdulrazak Ayuba is a motivator of peace and an achiever of pharmacy par excellence. He is happily married and blessed with children. And we have Professor Bashir Bello. Professor Bashir Bello is the, just a minute. Professor and sports physiotherapy on Ibadan. He's in the department, the physiotherapy department, Faculty of Allied Health Sciences, Bayero University, Kano. Without wasting time, I think we should move straight to the point tonight. But I want everybody to join me to welcome our speakers to this meeting tonight. But before we move on, I would like us to hear one or two things from our speakers tonight. All right, just a minute. Thank you very much. We have some questions for them, but briefly, each panelist will say one or two things before we move on. Just within 3 minutes, 2 to 3 minutes, I want you to, apart from reading your citation, I want you to see minutes. I will start with Professor B.V. Owoyele before I start with my questions. Thank you. Professor B.V. Owoyele, over to you, please.
Okay, thank you, dear moderator, for introducing us. I'm delighted to be here, and I'm as the president of the society. On a day like this to discuss the. I hope you can hear me.
Yes, we can hear you now, loud and clear. Thank you.
Okay. Discuss the intrigues regarding pain research in Nigeria. As has been said, I don't think I need to add more to what has been read about me, the president of the society, and I'm so delighted to have every one of us here. I want to say that in addition to the questions that will come, the audience can also ask questions at any point in time. And please, we are hearing some noises at the background. Please, if you are not a panelist, just mute yourself, please, and so that we can have a smooth interaction this evening. And those who are co-hosts, please, you can also mute people when they want to disturb this discussion. So I want to really appreciate this opportunity. I am the president of the society, and we also have relationship with the International Association for the Study of Pain as the chair of the fellowship grant and award working group of the society. So I don't want to waste our time. I believe there will be time for questions. Thank you very much.
Thank you very much, Professor Bibi Owoyele. Let me call on Professor Elizabeth Ngboli-Nwazo for a brief talk before we move on. Just 2 to 3 minutes, please.
Okay.
Professor Nwazo, over to you.
Thank you so much, Prof. Onosanwo, for the generous and kind introduction of my humble person and the other panelists. Thank you. Yeah, what we are talking about today is about carrying out research in pain, of pain specialty in Nigeria. And I just want to say that I'm an anesthetist, I'm an anesthesiologist. I've been involved in pain management since probably 95 when I started doing little bit of research work in pain management. I just want to encourage us that it is good to start and to start small. Don't think that it is something that is daunting or that you cannot achieve it. It's achievable, but just start and start small. There is nothing that will not count. Every single thing is important. So get your rubrics, the basic knowledge about research, and start off. Try to join people that have like mind. That means you must identify people that you are interested in what they are interested in. Get a mentor. Mentoring and mentorships are very important. They are key and they are pivotal. And yeah, just keep going. And you realize in no distant time that the sky will just be your beginning, your starting point. So I'll talk more as the discussion progresses, but I was asked to talk for just 2 to 3 minutes, so I'll not take much of our time. Thank you very much. I appreciate it.
Thank you, Professor Nwazo, for that brief talk. So Abdulrazak Ayuba. Pharmacist Abdulrazak Ayuba, please. 2 to 3 minutes, briefly.
Good evening, our distinguished moderators, the esteemed panel members. I am honored to contribute to today's discussion, especially at this year's global campaign with the team, Pain Management Research Education in Low and Middle Income Settings. As a higher hospital pharmacist, I've participated a lot, and I've chosen pain as a special interest in pain management. And I've been a focal pharmacist for narcotics for Ahmadu Bello University for so many years.
and we have created a lot of impact. We have joined together with Professor Odige Vicent, Professor Elizabeth, and other experts in pains. And as a pharmacist, I've been contributing my own quota a lot. Along the discussion, we will say more. Thank you very much.
Thank you very much, Dr. Ayuba. Then, and last but not the least, Professor Bashir, please can you speak to us, Professor Bello? Professor Bello,
yes,
you have the floor.
Thank you very much, the moderator. It's
Thank
a
you.
wonderful opportunity to be with you this evening.
Nice
I realize you didn't get my citation, but it's okay. I want to say hello and very good evening to my esteemed colleagues and, of course, my lecturers, Professor Bibi Owoyele and Professor Nwosu, the pharmacist, Dr. Abdulrazak Ayuba, other members of the Society for the Study of Pain in Nigeria, and my colleagues all joining us in this discussion this evening. The webinar for today, it's World Pain Day. Today that we're celebrating it on the 16th of October, 2025. Well, I am a physiotherapist, first and foremost. I had my first degree at Bayero University, Kano, and of course the second degree with my PhD at University of Ibadan in Nigeria, all through. Well, it's glad in my heart that today we'll be discussing about perhaps I will say the intricate challenges, and of course there are some hidden opportunities of carrying out pain research in Nigeria. Well, our beautiful country, Nigeria, more of how our research will shape our understanding. Of course, as a physiotherapist, I will be talking about my pain research from the musculoskeletal point of view, especially talking about dealing research in low back pain, arthritis, and some other MSKs. So I hope we'll be able to interact more as we move. Thank you very much.
I think our moderator is lost.
So I don't know if the moderator will want me to go ahead since we have lost him.
No, I'm here. I'm here.
Okay.
All right. Thank you very much. Then Dr. Ayuba, sorry, I know you finished from Abu as well, and it seems as if Abu people are taking over the webinar tonight. Nice to have you. You have some that came to Ibadan to learn from the premier university. That's good to hear. Thank you very much. Now we go straight to some of our questions. I will start with on this note that there are so many people in the area of research on pain, and I want to say also that there are not many people. What do I mean? There are a lot of people who are interested in pain, but they don't have access to some of the things that they can use to do their research. Let me ask you a question. How can we become a scientist with research focus in pain? Somebody who wants to become a scientist in the area of pain. Like my former supervisor of blessed memory will say that it's always painful for you not to understand how pain is or what pain is. Because at times it's emotional, at times you think of, how do I explain it? So it's always painful. Now, let me ask, how can we, as researchers in the area of research, how can we become a scientist with a research focus in the area of pain? I don't know, maybe I should start with Professor Nwaso.
Okay, thank you very much for that question. That's a very important question and it's a valid question. So how can you become a researcher? What is a researcher or who is a researcher? A researcher is somebody who is trying to search, trying to find out, to answer some questions. So to become a researcher, first you must have a mind of inquisitiveness, a mind to ask some questions and then try to systematically find out the answers. Now, there are basic key things about research. So you need to have a focus, you need to have a subject matter that you want to discuss about or find out more about, and then you need to have other key things. So how to become a researcher, first and foremost, is to start from the beginning. And like I said in my entry points, that don't plan to start big, start small, start with what you have. So what you have are the basic research tools at your hand. You may need to, you have to know the type of study you want to carry out. So you need to have a little idea about research methodology. Then you need to know your subject matter. For example, I'm an anesthesiologist, so I work on acute pain, chronic pain. Like the first earlier things that I did, I was looking at the pain management in our hospital in ABUTH area. And so first, we started with retrospective studies. That is to find out what is the pattern, or what are the trends, or how are things being done. So, and then, collaborate, work with colleagues. Don't think you can go it alone, or don't be a loner. Colleagues bring strength to whatever you're doing. So I partner with my colleague. Like, well, one of the first things we did that where I won a grant to go to the World Congress of Anesthesiologists in Cape Town in 2008, was to look at the pattern of post-operative pain management among surgical patients and obstetric patients and gynecology patients at ABUTH Zaria. It looked very little and simple, but when we started, by the time we got our data, analyzed it and all that, we were able to answer some certain questions and we were able to make some recommendations. We discovered then that most of the things people were using were just basic analgesics, opiates, and some opioids. Like the commonest thing then was pentazocine, tramadol, some petidine, sometimes morphine. And so we were able to advise that, look, we can do multimodal pain management. We don't have to do only these few drugs that we have. And it really helped us because our findings helped us to advise the policy on drug supplies. That was the early days. I was able to reach out to Pharmacist Abdurazak.
Some things are not just physical, some things are emotional.
Yes.
Emotional support.
Please, Professor Wazo has the floor, please. Can you allow her to finish? Thank you. Professor Wazo, please.
Yeah, so thank you. Sorry about that distraction. So we were able to advise, we were able to reach out to colleagues in pharmacy and say, look, give us more of this type of medications. We need to do more of regional blocks. Give us lidocaine, give us bupivacaine. And I remember that was the time we really now started reaching out to source for the other things that we could use to answer the question of our patients and to improve patient satisfaction. So how to become a researcher: start small, collaborate with colleagues, know the rubrics of research methodology, and learn and keep learning. And that's it.
Thank you very much, Professor Wasso. The focus on specific kinds of drugs that people have been using and persistence on working on those drugs, getting the rudiment of how those drugs will work and how they last in the body is very important. Thank you for that.
Thank you.
Now, let me ask our Professor Bibi Oyele this question. There are so many people that are doing research on pain out there. We have a local herbalist who are taking care of pain. They give some things, some natural products. Some are working in a lab, coming up with one or two things. And of course, our pharmacists are here, but I don't want them to talk first. But I want Professor Oyele to speak to this. Who can we call a pain researcher? An herbalist, a basic scientist, a medical doctor, a pharmacist? Please, who can we? Just in 2 or 3 minutes. Over to you, Professor Oyele.
Thank you, dear moderator. I think anybody that has something significantly to contribute to the understanding of pain and the pain management, if they have gone through some form of structured or unstructured education, and whatever they are doing can be proven one way or the other, I think we cannot sideline them. I know that the IASP in I think it was Montreal in 2010, actually invited so many people to a meeting where you have those who are in complementary and alternative medicine, acupuncture, and what have you. And the moderator will remember that we were in Italy for the World Congress on Pain, and we had a paper presented from Germany by a group who are looking at the effect of prayer on pain
Yes.
perception and what have
Yes,
we.
vividly.
So I think
Professor Shunyawo
generally,
was there.
and we were all surprised. This paper is coming from Germany, not from Nigeria, and they did this study in a teaching hospital, a tertiary hospital. Are looking at, and they actually found an effect of prayer reducing pain perception. So I think everybody that is involved in studying pain are very important. That is what the SS pain has stood for, that we have multidisciplinary nature. Thank you.
Thank you very much. Very insightful. Now, we have a lot of challenges in specializing in the field of pain in Nigeria. Because pain is everywhere. Emotional pain, physical pain, we have headache, we have leg pain, all sorts of pain. But what are the challenges to specialize in the field? I will ask Professor Ayuba. Professor Ayuba, sir, what can be challenges that we can face if we want to specialize in a specific field of pain in this country? Professor Ayuba, you have the floor, sir.
Thank you very much. We have to specialize in the field of pain in Nigeria. We have every specialist in this field faced with a lot of problems. One of the problems is manpower development. I remember when I was a pharmacist at Ahmadu Bello, when I just newly graduated, I was happy to have a mentor who is a Canada-trained pharmacist. That's the late Chief Obiaga. He really gave me a lot of advice on how to become a scientist. And immediately, even when I was not being approved or confirmed as a pharmacist, he gave me the partial approval to commence a research on pharmaceutical analysis at Ahmadu Bello, and that's where I get my my MSc in pharmaceutical chemistry. So if I was blocked, I could have lost my interest. Another very important thing in the field of pain in Nigeria is the availability, especially let me focus on narcotics, availability of narcotics in Nigeria. And it's become problem when there's no drug to even carry out a research. Also, the equipment that are involved in researches. There's a lot of some material or equipment that are not available, which hinder successful and meaningful research in Nigeria. We have to work on this. And I remember even the protocols, the regulatory rules that is really hindering the availability of narcotics in Nigeria. It has to be tackled. And I remember in around that 2021, 23, we met with the UNODC that come with the policy on availability of narcotics in Nigeria. And they brought in to decentralize the availability of narcotics, and they created these zones, 6 zones, 6 geopolitical zones for distribution of narcotics in Nigeria. Most of these narcotics, they are for medical research in pain. And if they are not available, you cannot carry out most of these meaningful things. In fact, sometimes people are having the phobia for use of narcotics, opiophobia. And this become a problem, a big challenge, not until when we started having policies for all healthcare professionals to prescribe and use narcotics in the field of managing pain. And this has come a long way, impacting on the success of pain management in Nigeria. So also the Cancer Society has also come because of most of this problem with a lot of study. I think myself and Professor and other team member, Professor Nwaso, conducted a 12-month training on how to entrench pains management among all healthcare professionals in Ahmadu Bello University. And it was a very big success. So it's a very multidimensional, and each items of challenge, funds, manpower development, availability of drug, regulatory bottlenecks, all these have to be taken care of. And I believe today, narcotics has been on the success trail of federal government, because the federal government established a narcotics DRF, where there is a scheme, a DRF scheme to handle narcotics and ensure the accessibility and availability of these narcotics to all the up centers, the 6 up center in the geopolitical zone. And I think for Northwest,
Mrs. Ayuba, you are muted, sir.
I think he needs to unmute. Can you unmute? I don't know if he's here.
Hello, are you here?
Yes, we can. We have you back. Thank you. Continue.
Hello?
We can hear you, sir.
We can hear you now. You are muting yourself.
Okay.
Yeah. Please unmute yourself, Professor. He has mistakenly pressed. Yes.
On now?
Yeah,
Hello?
you're on now. You're on now.
Okay.
Okay, yeah. What I'm saying here is
Okay.
that there are a lot of challenges, and one of them is we call structural challenges in terms of equipment, in terms of manpower, in terms of other regulatory bottlenecks. These are the challenges that affect the pain management in Nigeria. And there's a lot of efforts being put on board by the government. I think there's a very big collaboration between the federal government through Federal Ministry of Health and UNODC, United Nations Office on Drug and Crime. They've come a long way to change the policies on pain management. And there are a lot of narcotic guidelines that helps in making available narcotics in Nigeria. I used to know that we have to travel to Lagos to go and get narcotics. But now, narcotics is now in all the up centers. And again, for you to even get NAFDAC approval, it's a tug of war. But today, with an electronic guideline, you can just put in your request, send it to the Ministry of Health, send it to the Federal Ministry of Health, and then you get approval from NAFDAC, and the narcotics are available at your center for use. And we also have, there are some other Schedule 5, Schedule 1 to 5 that are also restricted because of drug abuse and misuse, and also illicit trafficking of drugs, or especially narcotics in Nigeria or in the worldwide, globally. And this also have a restriction and a guideline for making this drug available for research purpose, especially in the field of pain. But today we have a lot of robust participation, robust guideline effort of federal government through NGOs, so that whereby most of these drugs are available for use to manage patients. And at a practitioner level, most of the centers, like I want to cite the example of ABU, even when we have the narcotics, it gets expired because professionals, healthcare professionals are afraid to prescribe it, even when there is need. And also we have a diversion of this drug. It's another challenge. Some people, we've seen cases whereby somebody who's supposed to give narcotic drug is giving water for injection for people. And that's all, the patient continue to be on pain. So we have a lot of challenges, problems that are hindering the availability of
Professor,
drugs. Yes, sir. So what I want to say here that without drugs,
let me.
Hello?
Your line is breaking. Let me allow you to rest a bit here so that I can ask somebody else to say one or two things as well. Professor Bello, Professor Ayuba, can you hear me?
Hello?
Professor
Hello,
Ayuba,
sir?
are you there? Okay,
Yes,
yes. I said come back to you. I know you have a lot of things to say, but and you agree with me there are challenges. Why? Because a lot of people are also abusing these drugs that we are talking about, these painkillers. They
yes.
abuse, and government put a lot of control, and that's why people are not having access to most of them to do their research. So I think there are some faults on the part of the end users and even the government that is allowing those things to come in. We'll come back to that. But let me ask Professor Bello. There are, if you look at the number of people who are members of the Pain Society these days, the number may not be too much as we expected. If you come to our meetings, people may not be so many like that. What can you say? Is there a growing interest in the study of science and pain in this country? Because if you go to IASP meetings, thousands of people are there from all over the world. But if you look at people here, it seems as if, what do you think is responsible? Is it that we are growing? Is there growing interest in the study of pain? Or there is diminishing interest? Professor Bello, what do
Yes,
you have to
thank you
say about
very
that?
much, moderator. Well, this is quite
Yes,
an
sir.
insightful question, and I think the major issue is a local problem, which is attitudinal for me. I would say that because most of us as professionals, we want to hold on to our specialty, we want to hold on to our, I mean, the umbrella of your field, and that limits the way we interact in terms of pain. Now, like what our previous colleagues all have said, building on that, the challenges that are brought up, you see they are multifaceted. And therefore, the approach that could help to ensure a robust research on pain in Nigeria or anywhere in the world has to be multifaceted. Now, for every country where people understand that you need multi-specialty to come together to work, to advocate for how to ensure people get less pain, or pain research is being understood. Pain research is, people get to everybody involved. You look at the global partners for pain, the GAPA, they call on everybody, not even talk about professionals, even people living with pain, families, caregivers. So whoever has to do something with pain is welcome into the society, because the primary goal is to see that everybody gets to understand pain research. Everybody gets to understand why we must deal with pain. If you look at our society, the primary factor that brings about 90% of patients to hospital is pain. Now, conditions that don't come with pain usually lead to catastrophic ending. For instance, take for instance, hypertension. Hypertension in most cases do not come with pain. So our patients, our people here do not really know they have the problem. If you take an example, glaucoma don't come with pain. So most time, by the time the patient will be presenting to hospital, it's already a date on arrival. It becomes a problem. So whenever we know that, whenever any kind of case has to come with pain, it means people are supposed to respond to that. And people have to come out and show care and concern about pain. Pain is for all. The way it is being defined generally, is a ubiquitous language. Everybody understands pain, no matter how rich, poor, or wherever you be in the ladder of life. You go through one pain or the other at every point, or at one point or the other of your in life. So therefore, it calls for everyone to be involved in the research on pain. So I think it's something we have to do with attitudinal change. We need to change how people understand research on pain. People should stop saying, oh, pain is all about the anesthetist or the pain medicine person. No, every patient you touch, or everyone is involved in the management of pain. And therefore, for you to get, like what Professor also mentioned, how do you become a researcher? It comes with that readiness to help. If you have a solution to a problem, you want to provide a solution to a problem, then it means you need to be involved in pain research. For me, coming from the MSK level, about 99% of my patients only come to the hospital because of pain and maybe functional disability. So to me, I feel we need to change our attitude. We need to change our perception that pain research is for a particular group of people. No, everyone needs to be involved, because it is a multifaceted problem, and therefore it needs a multi-level involvement for us to be able to overcome the problem. Thank you very much.
Okay, Professor Basir Bello, that's very interesting. Now, let me ask you this question: how do you feel? Are you satisfied being in this field of pain research? Are you adequately rewarded? Because there are times you have interest. Some they want to do it just because others are doing. Some are doing it because they are interested. Some are doing it because they feel satisfied. If I may ask you this question, do you feel adequately rewarded specializing in pain research and management?
Yes, thank you very much, moderator. This is quite a very, very important question for everyone to have a reason. Why do you want to do this research, or why should you be involved in pain research? Like I mentioned earlier, 99% of my patients come to me because they have pain. And now you have used that pain method, you try to understand pain in various ways. Now, if I have to treat my patient and treat them properly, for instance, let me take an example of a patient with low back pain. If I want to treat my patient with low back pain from Kano, if I have a Hausa Fulani person, now if that patient comes to me with pain, and maybe the caregiver maybe is a husband or an in-law, the person may not be able to tell me the kind of pain he's going through, because he cannot say he has a pain while the family members are there. He feels that they will perceive that cultural problem is also that the patient will be feeling, they will say I'm a lazy person, or maybe I'm weak to show I have pain on my back and things like that. So I begin to think, what do we do to solve this problem? So it is that personal interest that you want to solve a problem is the motivation for every research, especially in Nigeria. You don't get money in research. The first speaker told us about funding. is one of the fundamental problems. There's a challenge in pain research or researches in Nigeria. You can take your meager salary in most of our researches. That's why you see that most of our research cannot be generalized because the scope is reduced. You know, they're not adequately powered research. You can't use them for generalization. So now, what will make you do your research? It is that joy that you hypothesized a solution and you want to see it to the ending. Those are the things Newton and all those scientists of Epstein on those days were doing in their lab. They identify something, they want to see it to the end. So in our case, it is not the issue of interest. It's not the motivation that you want to see what will happen at the end. No, our researches are built on, okay, I need quantity of a number of papers for publication. I just need to finish this to get my degree. It is not meant to identify a problem. And that's why most of our researches end in the journal. We don't take it out to even those people we used as participants because the interest was not to find a solution. And from there, you begin to see falsification of data. Many ills will follow. So the primary thing is to have an interest that you want to solve a problem that relates to pain. Thank you so much.
Thank you very much, Professor. Let me ask Professor Oyele quickly. A lot of people are going to research for different reasons and different purposes. Some may say, "Oh, I'm going to research because I want to travel and go and do my work somewhere." Some people are there because they want money. Some are there because they are interested in discovery, not the money. Now, Professor Oyele, if I ask you, what actually attracted you to the field of pain studies, pain research? Why? Why are you in pain research?
Okay.
Over to you, Professor.
Thank you, Mr. Moderator. Wow, that's interesting. I did my PhD research on pain because I think I was lucky to be supervised by Professor Elegbe, late Professor Elegbe, who was also a specialist in pain. And so coming under his laboratory, I had the privilege of doing my master's work in pain. And that left an imprint on me because I didn't actually do my PhD in Ibadan under him. I returned to Ilorin, and I insisted that I wanted to continue in that same line. So, and I was lucky that my supervisor in Ilorin was willing to allow me. And so that began my journey into doing research in pain. And it's just part of the bigger love for neuroscience. So I realized that it is easy to do research in pain, and not just for the money. In Nigeria, you probably don't have the money, but I've been lucky, even though that I have won TED Fund grant, NRF, and this and that. So I know that, but I didn't set my priority to make money as money making as the most important thing, because I do remember that when I won my NRF grant of several millions of naira, somebody told me, one of the young early career researchers said, "And so what type of car are you going to buy?" And I said, "Is this money for car? This money is for research." And it has really helped me to equip my laboratory to buy some of the equipment that when you go to World Congress on pain, you see them and you cannot actually get them to Nigeria. So we're able to buy one or two things. And then from what Professor Bello said, the interest to be able to weave a story, to be able to find some certain solution to certain problem. For instance, we did a study looking at pain perception, the influence of gender, the influence of ethnicity. So we had to look at pain perception in Yoruba people, in Hausa, in Igbo, and compare under different criteria. We also look at things like pain perception in people with osteoarthritis, people with diabetic neuropathy. I mean, looking at human subjects, we also have done things on animals, and we have looked at molecules of interest like neuroaestheticals, food that we eat. So these have been born out of interest, and that was one that really actually impressed me because I was in Japan, Yokohama. How pain could be personal, how the progression of pain from individual and depending on body constitution, things that are happening, immunity, immunology, and what have you. And I decided that, oh, of course, this is something we can actually do in Nigeria. So my travel has also improved my pain research, but generally, I think I love what I do. And as I'm saying, even if you want to make money, it might be a bit tough, but you can actually win grants like my friend and prof here, Professor Nwaso, has won quite a lot of grant from IASP. And I think you always have a component that you can use as a PI, payment for being a PI or a researcher. So, but most importantly, as a lecturer in the university, you also need papers for promotion. But I think overall, my interests have been a balanced one, that a journey of discovery and a journey to contribute to knowledge. And then I just love what I do. I don't know if I've shed a little light.
Thank you very much, Professor Uyeli. That's very interesting. Yeah, the interest is there. Then you want to impact other people with your discovery. Very interesting. Now, I will come back to the panel, but let me quickly go to the question box. There's a question here from Jeffrey Oloyede, Olabisi Onabanjo University. Now, he's asking a lot of questions. Let me just ask this question. It says, since narcotics are proven to be abused, people are abusing it by users, but important for research, then how there can be a regulation for this drug? How can we regulate the drug? Now, I want the panel to tell us or suggest effective ways, because part of the things we do here is to have a proposal, maybe to the government from our discussion here, if possible. So how can we of this barrier in using narcotics, despite the fact that some patients and to use for our laboratory research work? I don't know if Professor Waso can say something to that. Professor Waso, or if Professor Ayuba can say something. Professor Waso is not.
Moderator, please, can I beg that we allow our foundation president, Professor Olaitonsoyawo, to say one thing before she leaves. She put a chat message that she has to leave now. So let Mama please say one or two things. Professor Sonyawo,
okay, Prof is there. Okay, before we go to that, Prof, ma. Good evening, ma. It's Prof.
Good evening. Good evening, everybody. Sorry for changing your procedural arrangements. I'm very happy to be part of this. Yeah, I'm very happy to join you this evening, and I thank the president and panelists and the moderator. I just wrote a comment to support Professor Bello. I said, well said, because the issue of collaboration is very important. As we know, this, in fact, what Professor Nwaso said about starting small and being focused is how this society was started. Because just like she did, in 10 years after I started, I had a small research project because I had mentors. I had two professors who were members of IASP, late Professor Magbagola and Professor Akinyemi, and they introduced me to pain. And I had we, because I remember the data, we also had Professor Gureje, who is a psychiatrist. We had Professor Soya, who is a physiotherapist. Professor Amanobuadu, we were all doctors in those days, in the 90s. And in 1996, the paper that we produced on post-operative pain management in Nigeria, looking at the medications, looking at the results, and even the psychological aspects of the treatment. I went to Canada for the ISP conference, Vancouver in Canada. And because of that paper, I remember, because we talked about, we were using mostly this forbidden drug, which is still used in Nigeria, and that is pentazocine, because of lack of opioids. In those days, there was none at all. And pharmacist Ayuba, congratulations, you are still around too, because he was in the vanguard when we were looking for opioid analgesics in the country, until Professor Akunyili became health minister. That's how we managed to get some back. So, but that's the point I'm trying to make, is that at that conference, the president of ISP recognized the importance of us forming a society here. And he called me aside and he encouraged me that when I get back home, whether I would like to start a society. And I said yes, that we will work towards it. And that's how we got the grant that we used to inaugurate the society in 1998. And that's how the society started. We were all young professionals in those days. You can imagine 1998, how many years ago? And today, we are all, well, most of us are still in Nigeria. Even those who are not in Nigeria are giving back, because they still join us when we're doing things. And most of the work we did, all were in Nigeria. We went out to study and we came back. And we were able to mentor all those who are now working in Nigeria, either directly or indirectly. Imagine how many anesthetists Professor Nwosu has trained, and Professor Oyele's mentor is my close friend and also a physiologist, and I'm an anesthetist. So we had people all across board who were members of the society. So I'm suggesting that SSPN should repeat the advocacy aspect of SSPN, so that you can reach from grassroots right up to government to influence things, because that was the way, the pattern. Even the opioid issue, we had to reach out to international bodies like GAPRI, like American Cancer Society, and they invited us for meetings. So that is where the issue of money, you shouldn't think that research, there's no money in research. There's a lot of things that you can benefit from that will even be worth more than the physical cash you can get. Because if you get sponsored to meetings, you get a bit of allowances, you get exposure, you meet people, you get research grants. These are more than the salary you are going to get in Nigeria. And I put in my message in my chat that, well, because there was a question of whether you feel fulfilled or not. I said, I'm a pain researcher. I lived in Nigeria. I work mostly in Nigeria. And I can say that I feel fulfilled even at 80 years old. Thank you very much.
Well, thank you, ma'am, for that precious and rare opportunity to hear from you. 27 years ago, 27 years ago, and you are still here, ma. You don't even look it.
Well,
We are so grateful, ma, for having you around, and you are always encouraging us. Always telling us. I remember some years back, I almost got my part of my work done in Canada, if not for the government.
yeah.
I can go under when I was under Professor Lebe. We can't thank you enough, man. We can't thank you. No. Thank you very much,
Thank
ma'am.
you very much. Thank you very much, everybody.
Yes,
Thank you
you're
very much,
welcome.
Ma. We are grateful.
Yeah. Good night.
Quickly, can we look at that question again? The question of narcotics. A pharmacist, we need narcotics, and the government is not allowing us to use it. What do you think is the way out? What do you want to tell the government? How do we advise them? Do you put regulatory measures? Professor Bello, or is
Thank you,
Professor
sir.
Ayuba talking?
No, well, thank you very much, sir.
Okay.
I think I have a very different view. Nigerian government, through Federal Ministry of Health, have played a very huge role to ensure accessibility to narcotics. And I think there's a very big collaboration now with NAFDAC and NDLA. Any narcotics drugs that are for either management or research, there's a protocol, there's a guideline that one needs to follow, and you get it without restrictions. It's available. I want to say here that the UNODC has developed a national policy for control medicines, including narcotics. And if you follow this guideline, it is very easy to access narcotics. In that line again, I want to give kudos to federal government and Federal Ministry of Health, because I remember it's very difficult for us to access narcotics in the past. But because of the campaign and collaboration with UNODC, the government now established these geopolitical zones so that the researchers, the pains managers can have access to narcotics in all our health facilities, both at secondary and tertiary. And even community pharmacy, some community pharmacies are also identified to handle narcotics so that you can have access. But the challenge here is abuse of these drugs. And then the phobia, opiophobia. Some professionals don't even want to handle narcotics because of afraid of addictions and all the rest. And this is why the campaign, I remember we have to educate and create, even within Ahmad Bello University, to create a center, a unit specifically, and also give an instruction that only consultant or senior registrar can prescribe, because we are now seeing that there's abuse. So we control it, but the senior registrar and consultant can prescribe and ensure the patient have narcotics available, so that narcotics are available for the patient. And these are some of the
Now, Professor,
way forward
sorry,
as far as
Professor
narcotics concerned.
Sorry. Professor Ayuba, can I ask?
Yes,
there are a lot of people that are smuggling these narcotics in. How do you control that? How do you think the government can do that? They smuggle them. I know of people, I don't want to mention some tribes, when they want to do any work, they have to take this, they buy from, counter out there, which is not supposed to be. And it will make them strong to do extra work more than what they.
You see, there is always a problem. There are parallel markets.
For government to stop that?
Hello? Hello? Hello?
I can hear you, Dr. Ayuba. I think our moderator is having some
You see,
yes. Professor Ayuba.
Every system has its own challenge. You see, narcotics is a very big drugs, and there's a lot of illicit traffickings of most of these drugs. And I remember there are a lot of parallel importations, some of these drugs. I don't have a statistic at that time, because when you go to some of these open markets, there are a lot of parallel importations. And also, we also know that some of these drugs are fake. There's a lot of fake product coming to the country. You can access it in any market, but the federal government always says, go to the right source. We want to do the research today. If you place your order and your requisition to NAFDAC, and with a good proposal, it's going to be approved for you. But because of what it is, people want quick money, and that
Okay.
is why you see abusing people are now that fighting narcotics, and those are some of the problems. The government, the NAFDAC is also trying its best, because anybody caught with most of these hard drugs are being dealt with to face the wrath of law. And I don't have, I'm not one of the anti-craft of NDLA or NAFDAC, but they are doing a lot of wonder in this aspect. But there are a lot of, I don't want to say corruption part,
All right.
how some people can, bend their rules and get most of these drugs. But at least the
All
government
right.
is working out on that.
Thank you very much.
It's my little information. Thank you.
Okay. I just pray that government will be able to get it right and stop this from spreading. Now, Professor Waso, there are a lot of young people who are coming to the research of pain. A lot of them are coming in. What do you envisage that is going to happen to the field of study of pain with this set of people? Now, listen, a lot of them want to just get grants and travel and never come back. Do you see any issues with that? So what do you think are the challenges? What are the challenges do you envisage for our early career specialists? And what do you think can be the solution? Professor Waso, are you there? Professor Waso, can you hear me?
Professor Waso, you are muted if you are hearing us.
Okay, let me ask, while we are waiting for Professor Waso, Professor Bello, what do you think are the challenges ahead of our young people who are just coming off in the field of pain?
Sorry,
Those who are
Yes.
specializing. Oh, okay, Professor Waso, you are here.
sorry.
Thank you.
Did you ask me something?
Yes, I was
Okay.
talking about challenges for our young people in the field of pain research. What do you envisage? A lot of them, they are looking for greener pasture. After the first degree, they want to do research. They want to go abroad. A lot of you started here and you made it here, and you are still here. So how can you advise them? Or what do you think is the solution? Is it because there's no facilities again? Or is it because people are not interested in this country again? Please, Professor Nwasa, over to you.
Okay, thank you very much. Sorry. Yeah, so this is a very important question, and it's very, very apt considering that we're in the heights of the Japa syndrome. But you have to know that nowadays the drive to move outside the country is even more burning, it's even more serious than it used to be during our own time. But I still encourage the young ones. The there is light at the end of the tunnel. They should not lose hope. They should keep working at it. Yes, certainly there are issues that have already been outlined by earlier speakers, like lack of funds, like lack of facilities and equipment to do the proper kind of research we need to do. Like I won't say there's a real shortage of manpower as it was in those days. Well, right now I think almost every field is well expressed and still growing. There is opportunity to do more and do better. But what I see is that the challenges are many, and they keep getting more rampant, more rife. So but the call is also to people to just hold on, hang in there, and don't lose hope. You may find people that will go abroad, do their research, do their PhD, do whatever training, their fellowship, be it on a short-term or long-term trainings, and they will still come back to give back, just like our mother and founder, Professor Shoyonwu said that you know, the people that are outside the country are still contributing. They are still giving back to the community, to the society. So let's not lose hope. Let's be encouraged that things will only get better and better. And for the younger ones, yes, there's also problem with the poor pay or the poor remunerations of the people that are into research in general. When you want to say you want to do research, they will say, this one, this one wants to die poor in quotes. So but let them not lose hope, and you, be sure to know that there might be times that you will feel like it's not worth it, but delay your gratification. The problem now is that people want to sow today, to plant today, and reap the very next day. They don't want to wait for the time for the harvest to come and for the seeds that they planted to grow and mature before they start wanting to get the dividends, wanting to get the yield from whatever they are doing. But let's be encouraged, and let's encourage younger ones to hang in there and keep working on it, remain focused, and you are most likely going to succeed. Thank you.
Thank you.
I want to say just that one of the people, the strong mentors I had, is Professor Shoyanwu, and she took particular interest, in me and in so many of us at that time, putting us right, pointing us in the right direction, encouragement here and there, and, uh, making us aware of the opportunities and facilities that are available, so that if maybe there is a grant or a research or a conference or something, she will share it, or she will draw people's attention to it. So to the younger ones, keep working on it. Don't get despair, and you will certainly get there. Thank you.
Thank you very much, Professor Owaso. Keep on it. Don't be discouraged. And definitely, one day, one time, you will get there. I have a question. I'm coming back to Professor Oyele. Professor Oyele is the president of the society, and we want to know what is the plan of the society to promote research and pain management in Nigeria, especially when we talk about these young science pain researchers. What are the things we put in place? But before we go into that, somebody's looking for how to register, how much to pay. Please, you can see, you can always consult after the webinar. The phone number is there. You can also share with other people who want more people to join SSPN and also IA SP. Now, Professor Oyele, what are the things that are set in place, or what are the opportunities or encouragement? Is there any training, is there any meeting, or whatever, to promote research and pain management in Nigeria? Over to you.
Thank you very much, moderator. I think one of the ways we have encouraged research in the country and by the society is our yearly or annual conferences, which is TAG Scientific Conference and Annual General Meeting. So we encourage our members and aspiring members to always attend our meeting, and we encourage that no matter how small, no matter how big, we should try to send in abstracts and present our work. And then when we attend conferences, we can have networking. As I've told you, I was in Yokohama in 2016, and I got a researcher there that have led to I mean, not less than 8 publications from just attending one conference. So these are some of the opportunities we have had, and this our current administration had ensured that we started a journal, and I'm happy that maybe our editor-in-chief is can say one or two things about that. That's Professor Elizabeth Nwaso. She is the editor-in-chief of the journal. We just inaugurated it last year, and I'm sure they're about producing the first issue, and so she can speak to us about that. So we involved in, if we have challenges, we have been talking through our seminar, we have been bringing seasoned researchers, and we do believe that these seminars, these webinars that we have monthly is not just for education alone. We can reach out to those who have given the webinar. We can collaborate with them. We can work together. We can have a good output, in addition to the outreaches that are being expected. So in addition to that, as I told you, I'm the chair of the fellowship, grant and award group of the International Association for the Study of Pain. So an affiliate member of the International Association for the Study of Pain. So in this instance, we are involved in promoting the activities of the IASP. We encourage all our members to tag into some of these grants. As I've told you, Professor Nwaso have won quite a lot, and a lot of other people have won too. Mama who just told us about that. So these calls are there: early career, collaborative research grant, and what have we. And if you're a member of SSPN, you can also benefit. And recently, in just early this year in February, we were in Nairobi to promote training and of pain professionals. So we are creating that opportunity for interaction. And this webinar today is one of the ways in which we are also trying to promote research in the country. And I must say that this research is tagging into the global year theme for the IASP, which is education, training, and pain education, pain training, and research in low and middle income settings. So we are key into that global year theme, and that's why we have brought this webinar. So please let everybody reach out to us. We want anyone that have a research opportunity to make them available, and for people to collaborate, network, and that's the only way, because individually, when we're in our silos, we may not be able to make as much progress as possible. But as we are multidisciplinary, so you can find a basic scientist, we have nurses, we have pharmacists, we have dentists, we have veterinary medicine people, and we have anesthetists, we have physiotherapy. We are just diverse, so we can always collaborate and do one thing or the other. So I think our members should make use of this opportunity, and this is the platform that we'll have for every one of us to interact with each other. Thank you very much.
Thank you very much, President. Our time is fast spent, but I want to find out if there's anybody online that wants to ask any question before I ask the panelists to give their final proofs in the country. Anybody online, maybe your question?
There's a question in the chat box.
You have not been. You may want to ask your question. Ask our panelists to give advice, what they have to say about pain research and education. How can we improve it in the country? Just 1 minute or 2 minutes.
Yeah, so that means the person can unmute and actually talk.
Before I do that, anybody with a question?
There's a question in the chat box that is not yet answered.
A platform. If you are not a member yet, I want to encourage you, please, you have the phone number of the treasurer. You can always contact so that we can put you on the platform. Then your questions can be also be answered on the platform thereafter, because we don't have all the time. So if there's no question for time,
Doctor, no, Dr. Ayuba, can you read the question?
Anybody with a question? In the absence of none for now.
Moderator, there's a question. So let's.
In the chat box.
Yes,
Okay, so can you read out the question? I mean, Dr. Ayuba, I think you are able to see the question. Let us know what the question is about.
okay. I'm trying to see the question on the blackboard. The question is no longer there. Maybe somebody just.
Can I read them out? I'm Professor Jolly.
Yes, you can read. Please, your question.
What resources and focus areas would you suggest to guide us in improving qualitative research in pain education by Stephen Ghana from ABUTH, Zaria?
Okay. Professor Bello, any response to that or any other person?
Yes, I think it's a very valid question and it's very key to the discussion this evening. Actually, the aspect that the global partnership for pain advocacy is looking at presently is how do we look at pain from the perception of people living with pain, you know? And those are qualitative researches which we don't normally pay attention here. Now they're trying to see how do we begin to understand pain from the perception of that person that is telling us he has pain. You must believe with me, the way House of Fulani man will tell you about pain perception is not the same way a Yoruba man will say. It's not the same way that the Igbo person will tell you. So I think it's very, very important. And that's where qualitative research comes in. Most of our researches in Nigeria, perhaps maybe due to our mindset, is always quantitative research. Okay, we need to begin to also advocate for people to understand why we should try to do some focus group discussion, some interviews. You know, we begin to learn a different aspect of qualitative researches, because this is only research that can probe in to those exploratory or you know, how to identify or understand this pain from the person living with the pain. So it's quite important, and it starts from class. I will enjoy the person who asked the question that you know, these are aspects that you need to take some rudimentary in qualitative research, and you don't get those research modules is usually in continuous medical education. But of course, if you put in for maybe a postgraduate program, a master's, and you set up your research to be exploratory, because really most of our research lack that qualitative aspect. The moment you have a research question, you probe a problem, the first thing you do, you go look for the scope of the problem. How much is this problem? So you talk about the epidemiology of pain in that community or in that culture. And then the next thing you do is to begin to see the qualitative aspect. You know, is it you're going to use a focus group, or you want to use an interviewers or expert panel? So you use different approach to dig into the person going through the pain, or the professional that is doing the intervention. So all these will give you how to explore their experiences, you know, their perceptions, and so on and so forth. So this is where the qualitative aspect comes in. I think you need to start thinking of your research from that area, and of course, taking courses maybe from a master's degree or other postgraduate program. Thank you very much. The moderator, can you hear me, or you think I should go ahead?
Thank you. Oh, no, it's okay. I was really enjoying your words. Each of the panelists, in one minute, if possible, just in 1 minute, find in this country, how we can improve them in Nigeria, how we can improve them in our local places and in our environment. Yes, let me start with Professor Professor Nwaso. Ladies first.
Thank you so much, Mr. Moderator, Professor Onoson, our amiable co-panelists, and all the discussants this evening. Yeah, well, the discussion has been quite robust, and really 1 minute is not enough to to
I know.
summarize. Yeah, but what I need to say is I saw some things in the chat box. I don't know whether it was addressed. There was this thing about narcotics, that we should have an effective way to actually solve the barrier of using of narcotics. That was by Jeffrey much earlier. So I want to just address this by saying that some of the things we've done in the past and we still work is by advocacy. So in the early days, we did a research on the pattern, the prescription pattern, the pattern of pain management, cancer pain management in ABUTH area. And we found that there was some tendency to opioid phobia, that is the fear to prescribe opioids or under prescription of opioids. So because of that finding, we set out to start talking to people, our colleagues, healthcare providers, our patients, the families of pain sufferers, and we encourage them, we give them information about the different other medications apart from opioids, the different other approaches to pain management. And then, we also did things like talks on the radio, on the television. We had rallies, we had workshops. During several of the grants that I won that had different focuses, we went around all the geopolitical zones talking about pain relief in labor. Then we talked about neuropathic pain management, pain in HIV and AIDS, and diabetes mellitus, and things like that. So awareness, creating awareness is one of the ways to reduce the fear of opioids, counseling of the patients themselves, and education, educating the patients and their family members on the different drugs and the important things to do. And then the question about qualitative pain research. I think Dr. Ghana has got a good answer from Professor Bello. So, but a lot depends on us. A lot depends on not. The quality of our research depends on how much we are ready to put in. There's dearth of facilities, lack of equipment, lack of proper or adequate funding. But if you have to do research, you have to go an extra mile. There was a time that we had to, like out of pocket source for funds to be able to buy certain equipment to be able to conduct our research. And when we talk about this, let's see it as a form of investment. Don't say, oh, you're waiting for a big grant or you're waiting for somebody to come and give you money to do it. See it as your own form of investment in your career. And so this is just to summarize, let's keep working harder. Let's spread the word that pain research is very important, very vital, and it is what will help to grow the specialty of pain management in our communities and in Nigeria as a whole. Let's also remember that nobody is an island. We should collaborate and work with other people as a team-based multidisciplinary approach will win the day anytime. Thank you very much.
Thank you very much, Professor Wasso. Collaboration. People in the clinic, people in the lab, people on the field. We have to bring everything together to get. That was a very good one. Let me ask Professor Ayuba to speak next. Professor Ayuba, this is a man. So
thank you very much,
within
sir.
2 minutes, I want you to.
Thank you. I'll give you 1 minute. Thank you very much.
Yeah, thank
Yes,
you.
I just
You have the
want
floor,
to add here
please.
that thank you very much. I want us to look at the structure of the research itself. Some of us, when we want to carry out this, there are a lot of complex ethical review processes. I think we need to streamline most of these review processes so that people can have a very good. I remember I wanted to carry out a research, and I had to write about. My proposal was turned down more than 20 times, and I almost lost in interest. So we need to look at the simple ethical review process so that when you are satisfied, you can carry out this. Something. Again, we have to try and see
That
how
can be
we
discouraging.
stigma, cultural stigma concerning research. Most patients don't want to come up because of certain, let's say, sickle cell anemia and all the rest, or HIV, and you want to carry out a pain research. They will not want to come out, not until when you disabuse their mind on stigma, so that the people can cooperate with you. And another thing is that we are campaigning seriously on the course of medicine. No drug, no research. So the drug aspect is sometimes you start a research, and by the time you want to buy that drug, we are not even talking about standard sample, which is not even available in the country. Most of them you have to get it online, and you have to look at the dollar exchange and all the rest. And these are the things that we have to make sure that we address. Hello, these are some of the things we have to address to make sure that at least the research is very smooth, is very accomplished, and it has impact that can benefit society. Thank you very much.
All right. Thank you. Thank you.
Have we lost our moderator?
Yeah, it seems we have lost the moderator.
Oh, okay. Just before the other people round up, Dr. Professor Elizabeth, there is a question that have not been answered. Can you hear me?
Okay, I can hear you.
And it's from Kolawole Falilat. He said, how much research is done on the safety of epidural steroid injection for pain management?
Okay, thank you so much, Falilat Kolawole, for that question. I saw it earlier. I actually thought it has been answered. So, well, that epidural steroid injection for pain relief has been a long-standing practice, and in fact, one of our colleagues, an anesthetist, Dr. Zachary, he did a lot of work on that in Ilorin, and I myself, I did some work on epidural steroid injections. Some data also of the work done was not published, but I agree with you, the questioner, the person, Falilat, that not much work has been done. So that's what I can say. Not much work has been done, and it's still it's more or less like a virgin area. It's a field that, you know, if you're interested in it, you can develop the research questions and actually, you know, work on it to answer that question. So it's still open. It's still a very good area. It's a fertile ground to work on and to research, to do your research on it. So please, the floor is open, or the ball is now in your court, since you are interested in that area, to actually develop research on that and feel free to reach out to me or to any of our colleagues here so that we can, work with you in that area. I also remember that the president asked us to say 1 or 2 words about the journal. So the African Journal of Pain Research and Practice has been born, and it's a very big avenue for us to showcase our research work. We know that some of the problems that we're having is that we do research and it doesn't get acceptable or accepted in some other journals. So this journal is for the Society of Study of Pain in Nigeria, and we are looking out for manuscripts. We are going to press very soon, but we still need more manuscripts. So if you have any work you've done, there's unpublished data, whatever, you can reach out to me or any of the panelists, and we'll be able to give you whatever you need. I will drop the email address for the submission of the articles so that anybody that sees it and can quickly, submit their articles if you have any manuscripts at hand. Thank you very much.
Thank you very much, Professor Wasa. Sorry for the break in transmission. I don't know if Professor Bello has spoken or Professor Bello was going to say something for 1 minute before we go.
Okay,
So
thank you very much. Very quickly,
Yes.
Mr. Moderator, I think I want to leave us with 3 take-home messages. Number
Please,
one is we've been mentioning, or the professor also told us at the beginning, that in pain research, we should just think about starting small. But for me, I want to tell us that, of course, we should start small, but we should emphasize on low-cost, researches. Our research should be low cost, but it should have a high impact to the problems. So high impact solution, but at low cost. I remembered my first grant I won to travel for this was in 2017. I was only talking about working in the management of low back pain, chronic low back pain. I mean, the research was about walking because it comes with a sustainable developmental goal. And for me, this is one of the most cited researches I have ever published, just walking. So I think we should be, because, a local problem needs a local solution. So let's look inward and not start thinking about use of functional MRI and so many costly equipment. So let's start with low-cost equipment or low-cost solutions that have high impact. And number 2, I also want to call on like the SSPN to see how can we integrate pain ethics in our university curriculum for all health students. So if we begin to teach pain ethics, right from our universities, level 1, level 2, like this general course, it begins to bring about something that creates the collaboration from bedrock. All students in the College of Medicine or College of Health Sciences will have to undergo a pain course or pain ethics course. So something like that, if SSPN can make that move, especially now that we're still working on what do you call the CC math, we can see how do we find a way of integrating pain ethics into our curriculum for all health students. And of course, we should also see the biggest power we have for pain research is interdisciplinary research. You see, I said it earlier that our attitude must have to change. I am one of the, committee member of the HREC of my university. If somebody sees a pain research coming from a physiologist or somebody from a nutrition department, or maybe some of us are surgeons, somebody as the medical doctor can frown on it. I remember somebody wanted to do pain research because it's coming from basic medical science. The doctor in the hospital did not give him opportunity to see his patients. So we just have to come together. I think this interdisciplinary issue we must find a way of tackling it, because the most robust pain research come from interdisciplinary participation. So with these three messages, I want to tell us, thank you very much for giving me the opportunity to speak with you this evening. Thank you so much.
Dr. Bashir Melo, thank you very much. Perfect suggestions and counsel to the people out there. We should start small, but let's see how we can address the issues. Number two, you said we should bring in pain ethics. Very, very important. And it will take care of all the issues that the Professor Ayuba was talking about the other time, about restrictions and all that. And interdisciplinary collaboration. There's nothing we can do without collaboration, and that is what the world. Uh, that's where the world is going now. And finally, I'm going to call on the president of the Society for the Study of Pain in Nigeria to give his own counsel and word of encouragement. Professor BV Oyele, over to you, please.
Thank you, dear friend, the moderator. We've gone to different ISP conferences, and I'm delighted that we were able to call you at just the last hours to come and moderate this session, and you have done wonderfully. So thank you so very much for coordinating this activity. Please, I want to encourage every one of us to play our role. If you have any information for the society, let us know. If there's any contact in Abuja or anywhere where we can actually do our advocacy to improve pain management and treatment and research, let us know. I want to thank those who have been cooperating with us. I want to thank Professor Elizabeth Nwaso for agreeing to serve on this panel. To thank Dr. Ayuba, Professor Bello. I believe it has been a wonderful evening. And I want to say behind all this planning that this idea of this webinar actually came from a webinar that I did with a group for the IASP, and Mama Sonia was there, and she said, Professor Oyele, you must try to replicate it for SSPN. And so in keeping with obeying our instruction, here we are. And I think we have had a good night. So good evening. So thank you, everyone. And let's keep the flame on, and let's keep doing the work. I think Professor Bello has said something so vital. I wanted to do a work on osteoarthritis, and we wrote for ethics, and it was never approved till today. Despite the fact that the person that wanted to do that work was a medical doctor. I am a basic scientist. We couldn't do that work. The person has to go and do a work on rats. And these are areas that we actually need to look at. So some of the work that I have done, I have collaborated with my student who are a physician, and then it has made some of the ethical approval easy for us. So as a basic scientist, I've collaborated to publish some work on patients here and there. So I think those of us who might be in the basic and think maybe it's not doable, it's actually doable. I'm sorry, I'm going to run now. I was reading about the ISP have a free publication on the editors of the editor, and he was a basic scientist, and most of the work that he did were on patients here and there, collaboration with consultants, with people in the clinical setting. And I think we need to just increase that sort of collaboration. And I think I want to appreciate Professor Nwaso, not just being in the clinical setting. I've seen even developing people in the basic and working. And I remember there was a time she reached out and she was to do some work in the lab where I went in Italy. So this is the spirit, and that is the only way. Because aspirin, acetyl acid was discovered from willow bark. This is from a plant. So we just have to explore all the things and the resources that we have in this locality. And for our local content into it. Except if there's any other thing you want me to say, but I'm happy.
Okay. Thank you. You are, but the president is going to speak last. But let me just, on behalf of the SSPN, thank our panelists today, the four of you. We have our pharmacist and our doctor, Abdulrazak Ayuba. Thank you for coming. And
Thank you, sir.
also another veteran, Professor Bello Basir. Thank you very much for coming. And the only lady amongst them, Professor Mwazo, my very old friend. And of course, my dear President, Professor Bibi Oyeli, I want to thank everybody. Myself, S.A. Onoso, a professor of physiology and the head of department, physiology department, University of Ibadan. I want to thank you for the privilege. President, I have to say the final say because I can't be the final talker here. President, I will hand over the microphone to close the meeting. You are the owner of the meeting.
Okay.
Professor Waso, see you.
Yeah, before you close, there is a question in the chat box. They said,
please,
hold on a bit. There's a
let's go to close the meeting.
Yes, there's a question that says from Afian Ma Gabriel. It says, please, how can one apply for the supply of narcotics to a facility for a study? I don't know if we have an answer to that.
Yes, okay. Supply of narcotics. I think Professor Bello said some things about it.
I think it's Dr. Ayuba. Dr. Ayuba.
Dr. Ayuba, no, okay. Yes.
Yes. I think the person that reached out to Professor Ayuba.
No.
Professor Ayuba.
Dr. Ayuba is talking now. So.
Okay, Professor Ayuba, please go ahead.
It has been simplified now. You just put up a requisition through the chief medical director or the MD of the hospital, through the state ministry of health, and then send to NAFDAC. The NAFDAC will give approval and they will give the cost estimate, and you get the drug.
Wow,
as simple
marvelous.
as that.
Thank
Yes,
you.
it's very simple. Everything electronics, no need to travel.
Oh, really?
Yes, you don't need to travel.
All right.
I have there's electronic guideline. You follow it, you get your narcotics as required. Just follow the guideline.
Oh, thank you, Dr. Ayuba. Thank you very much. I appreciate you and your counsel. There's no any other. Professor Oyele, over to you, please.
All right, so it's just to say a big thank you to once again to all my distinguished panelists, and for a nice evening, and for contributing to the growth of SSPN and pain management and research in Nigeria. We appreciate you on this auspicious day. Okay, tomorrow is of the World Pain Day. Actually, it is also said World Day against pain. So we are not inflicting pain, but we are trying to see how pain is being actually managed. So please let us increase our participation in the activity of the SSPN. If you are not a member yet, please, we have a presence on WhatsApp, we have a presence on the internet, we have a website. So please do reach out to us, and as much as possible, we'll take your questions. There are a lot of benefits that you have being a member of SSPN. Currently, we have the American Cancer Society running some training for our consultants and specialists. And then we also have the Global Online Pain Fellowship that is recruiting people now. And one of the requirements is that the president of SSPN must write a recommendation letter. I think as I'm standing now, we've written not less than 45 letters in the last 2 years, and we are prepared to write. As the cycle have begun, I think I've written about 6 already. And it's going to continue till January. So please, we are there to support you and to make sure that you get all the benefit that you deserve. So as much as possible, let's join hands together to promote the work that the SSPN do. And if you have any question, please reach out to us. And please, this recording will be posted on our YouTube platform, so you can always come back to watch it. And as a member. So you will see the link if you're a member, and then you'll be able to. But even if you are not a member, but we encourage you to be a member, just search out for Society for the Study of Pain Nigeria. We have a lot of educative materials, past webinars that have been uploaded on that particular YouTube platform, and you can watch them for your own education. Thank you so very much, everybody, and have a very good evening.
Thank you. Good night, everybody. Bye.
Thank you, Mr. President. Thank you for thanking us.
Yeah.